Sunday morning. Well, calling back today, we were on with him on Wednesday, Dr. Mehmet Oz, and to give us an update, maybe what's going on with all the fraud, et cetera, et cetera, et cetera. Dr. Oz, give us an update. What the heck is going on?
Well, today's a good day to go to church, and when you're at church, you learn about being righteous and how you take care of your neighbor, and that's how we're judged as a society, how we take care of those who are most vulnerable amongst us, and we are not doing as well as one would hope because of the fraud. And if you're thinking about this problem the right way, you will acknowledge that the best thing we can do to protect folks who are struggling is to make sure they get access to the resources that we have provided them. As a great people, we've created over the last 60 years these beautiful social safety net programs of Medicaid and Medicare, but they are being defrauded, and they're being hurt oftentimes by foreign governments or foreign-run criminal syndicate organizations. And right in New York, Nick, Shirley, and I spent some time investigating what's going on in Queens and Brooklyn. Now, in these boroughs, they have these programs, especially in parts like Flushing, Queens, where there's a large Chinese and Korean population that has immigrated to this country. And they have a culture of getting together in what are called social adult daycare centers, where you sort of get together, you play mahjong or bridge or tai chi, or you hang out a little bit, right? Many societies do that for their elderly. They have a place to stay. Normally, the government doesn't pay for it. In New York, because New Yorkers are so kind, they created a mechanism to pay for these programs. And what ends up happening, and these are run, we believe, under the auspices of the Chinese organized criminal groups that are also doing human trafficking in the East Coast, they have managed to basically own the Medicare beneficiary cards of the seniors that go there. Let me explain that. You're an older person. You go to this club. You say, hey, what do you got for me? And the owner says, I'll give you $1,000 a month. You pretend that you come here every day. I need your Medicare beneficiary number. It's like a credit card number that Medicare gives you. Give me that number, and I'll just go off and do what you want to do. I take that number, if I'm the owner, these criminal groups, they start to charge fake things against that number. They pretend they're sending this really expensive wheelchair. They pretend that they're sending expensive branded medications. They're scheduling appointments they never go to, tests they never get, treatments they don't receive or don't need. And they begin to bankrupt all the legitimate people because they make so much money, they buy up the entire business. We believe most of these programs that have generated $2.1 billion against New York Medicaid, which of course I have to reimburse because I run Medicaid at the federal level, is being stolen. And just to put it in context, the entire state of New York uses only $400 million. So these guys have $2.1 billion in two boroughs. And we have, with Nick Shirley, been investigating these guys. These videos are all over social media. You're welcome to the show and listen to clips if you desire in the show, but people should just check them out. You can't look away from these fraudulent activities. They bought up all the pharmacies. There were a dozen pharmacies on one block. Why? They're all fake. They're taking these Medicare beneficiary numbers and manufacturing huge businesses to fund illegal activities. These bankrupt our society, and we are pressuring New York State to look seriously at these programs, and because these are run by the state. We reimburse, but the state actually creates and runs these programs, and it's, to me, representative of what we're seeing in other parts of the country. We have twice as many durable medical equipment suppliers in South Florida than McDonald's, and that's often run by Cuban nationals, and we believe the Cuban government.
The last time me and you talked, there was a big difference in Medicaid. Medicaid from Florida to New York. One was $25 billion, and the other one was $125 billion in New York.
New York has the highest per capita spend on Medicaid by far in the country. New York has developed a plan. They call it Medicading it. By that, they mean we're going to take an expense that the state should pay for, and we're going to dump it on Medicaid. Because although New York is spending a lot more per person on Medicaid, New Yorkers are not paying the bill. They're paying part of it, but the federal government's paying most of it. And so it's not really a flaw for the governor of New York. It's a feature. Why? Because if I take somebody and pay them to carry their groceries upstairs for their parents, which we are doing in New York State. The number one job in New York State, by a factor of 2, is people who do that. They're called personal care service individuals. They're basically people who are living in the neighborhood, maybe your kids, doing simple tasks for other people living in the neighborhood, and we're paying them. Like, these are things your family would normally do for you for free. But when you pay for them, the state says, I had someone who was unemployed. Now I can employ them and charge the federal government. I mean, how brilliant is that? So now it's a jobs program. And I'll add one more thing to it. We've learned that the unions are now unionizing these people, which means the federal government is paying salaries that go to union dues, and then the union dues fund the campaigns of the Democrats in the state. So now you have political patronage on top of a jobs program. So, John, you tell me, isn't that a really smart thing to do if you're leading the state of New York?
Well, and it looks like it's a benefit that they give all the people to keep themselves. New York is like 70% or 60% Democratic, and it's using the federal government money to do that.
Using the federal government as a piggy bank. The problem is that if every state does this, there's no more money left in the federal government. And guess who does it better than New York? California. And so you now begin to realize there's a run on the bank. If the federal government's not willing to clean things up, this is what happens. The congressmen who voted to support the working families tax cut legislation, in that law, they stopped the legalized money laundering that was taking place by states. What the law says is that we are making sure that whatever the president is trying to do to help the country, any president, is the same basic goal that the governors of the states should have. And so if we're going to spend money on health care, the money should be spent in the way everyone's agreed, which is the federal government pays a little bit, the states pay a little bit, and then we have enough money to take care of our most vulnerable. That has been perverted. And because of that, every state is trying to grab as much money as they can without paying their fair share, and some states are better at it than others. But eventually, every state gets good at it. And so when that happens, there's no more money left to take. And all of a sudden, the whole bottom falls out. The corrupt fraud is not just fraud. It's fraud that's arising because government wants it to exist. And that is why we've ended up where we are. In addition to the fact that during COVID, we taught criminal organizations that the federal government is a pretty good piggy bank.
Understood. What else? Sunday morning, we got another minute left. What would you like to say to all our listeners? I mean, there's so many things to talk about, but you tell me.
Well, the best news I can give everybody right there is we have an all-of-government approach. The president has, during the State of the Union, asked the vice president to run the White House Anti-Fraud Task Force. What that means is that Treasury and Commerce and my agency, Health and Human Services and Medicare Medicaid and all the different elements of the government are all pulling the oars in the same direction. I'll give you one concrete example. If we find or suspect that someone is stealing from Medicaid, you know what we do with that person's number? We give it to the IRS. And here's what we say. This person we think is stealing from Medicaid. If they're willing to steal from our most vulnerable, they're probably not paying their taxes. Check it. And although they can't tell us what they find, they shouldn't, and they don't, it is helpful for us to be able to pass along this information so we can see if they're cheating other parts of government. Because if you steal from one part of government, you'll go ahead and steal from all parts, because what you really are saying is, I don't care about America. I'm just going to take advantage of this piggy bank, take advantage of the American people, and I'm here to say no mas. Secretary Kennedy, me, under the leadership of the president and vice president, no more. We are watching you, and if you're hearing this broadcast right now, don't just walk away from us. Start running, because we're coming after you.
Dr. Mehmet Oz, thank you for what you do for our government and what you do for all Americans and making things better and more efficient. And let's talk more often, and thank you so much.
God bless you, my friend. Take care.